Good morning. This is Dana Parsons, and welcome to our weekly coronavirus call. Thank you so much for joining us today. I have a few announcements before we get started. I wanted to mention, if you would please, um, when you receive your update today, we have an action alert to send to Congress for support for home and community-based services, which includes a Medicaid FMAP increase for home and community-based services and dedicate funding for adult day. And telehealth support and so forth. So if you would please send a message, just click a link. I'll also put that link in the chat box. While I'm speaking about the updates, I wanted to also direct you to the fact that our updates that we're sending on Tuesday, Wednesdays, and Thursdays are also including some unrelated COVID issues. So make sure that you please take a look at that. There's some information in yesterday's regarding an MDS update for October 1st. So I wanted to make sure that everyone is checking out our COVID updates that include a lot of information that you need to know. You can see from our slide that the call is being recorded. Our call for next week is tentative. If we do not have a pressing matter to discuss, we will cancel that call and take that off your calendar. But we know that a lot of communities are struggling with the issue about how to handle employees needing time off due to school closures and remote learning. We're very pleased to have Dee Burcoin from LeadingAge, the Director of Life Plan, Community Services and Policy with us today to talk with us. Dee and I have talked prior to the call, and we really want this to be a conversation. So we will begin with Dee, but if you could please include your questions in the chat box. And Melissa Andrews will be providing that information as the call goes on, because we'd really like this to be a conversation today. So over to you, Dee. Thank you for joining us.
Good morning, everybody, and thank you so much for inviting me to join you again. It's great to be with you back in Virginia. And just like Dana said, we do want this to be a conversation. I've been holding similar conversations with other members in other states as we're all, really avidly watching the news and seeing what's going on with plans for school in the fall. And as I always do, I like to start off just by saying, again, thank you for everything that you're doing to support, your residents, your team members, and of course yourselves, because this pandemic is just continuing on, and so are we. And it's such an inspiration just to work with you all and try to help connect some of these dots. So yeah, the question really is, how is your community handling the employees' time off? So I've talked to various folks about this, and the initial reaction from a lot was, well, kind of the same way we were before, but still trying to navigate what to do about leave, what to do about on campus, possibly offering childcare options on campus, off campus, to help employees find, ways to have childcare and supervision for their kids at home. On the other side of the coin too, to be honest with you, I've talked to some folks who are in areas where schools are reopening, and they have a whole other host of concerns that if we have time, I'll mention those as well. But on the first side of the coin, which is, school closures and remote learning. So from a pragmatic standpoint, I mean, again, folks as employers are weighing, how and if people can use leave, and then once that leave time is exhausted, and if they've already exhausted the expanded FMLA, how to navigate that with employees, if it's unpaid time, if it's an extended leave of absence, or some other combination to try to work together to at least preserve their employment. As one member said, some of our employees are really feeling pretty desperate because they feel like they have to make a choice, between working and then being home with their kids, and then even if they're already in an economically delicate position, that they actually might need to consider moving on to more of a welfare program. And so, what I've heard members talk about so far is, trying to find ways from a pragmatic standpoint to support their staff. Looking at, once again, can we do partnership with local community agencies like the YMCA to provide some childcare services, daycare services? Can we, actually I heard one member talking about what they're calling a virtual learning center. And this could be on their campus or nearby. They haven't really decided yet, but a space where in very small groups, socially distanced, that the children of employees who are like middle school or high school age could come and use internet, and there would be supervision provided to make sure the day goes well and that kids can log into their online learning platforms at their schools and have somebody there as a resource. So that's something that one provider was talking about doing. Others have looked at similar, enrolling kids in local daycares together with other organizations. And one member said that they tried that in the spring, and they only had a few kids to start off, and it dwindled down to just one kid, and as employees found other solutions. Another big concern is for employees who are dependent on their own parents to watch their kids, as folks now know so much more about COVID-19, as they're realizing that there's a potential there that their own parents then could be exposed, and so how to protect them. So so those are just some ideas that members have been talking about from a, you could say, a pragmatic or operations standpoint. I am going to share a couple things just as examples in the chat box here. So Hebrew Senior Life, I think I might have shared this with you before in a different context, but they have a lot of great resources on their website. They're based in Massachusetts. And if you scroll down to their human resource policy section, they have a few of their policies posted online. And then I'm going to try to, I don't know if I can put a file in this one. I'll send a file over to Dana. I do have a sample policy as well from Piper Shores up in Maine that gets at some of these considerations from a policy standpoint, and how people are actually able to apply for and use their leave time. So I'll take a pause there. Like I said, I also can share on the other side of the coin some concerns and ideas that I've heard members talking about in areas where schools are reopening. It's not going to be immediately relevant, of course, in Virginia, but it might be some good food for thought. But let me take a pause and see if there's any questions, or, like Dana said, if you want to share what you're thinking about doing to help manage this consideration with employees taking time off or needing time off for childcare.
Yeah, I would just take this opportunity to ask members, not necessarily to use the chat box, but if you just want to speak up and talk about some ideas that you have or questions that you have for Dee about any suggestions on how communities can handle this situation.
Dana, this is John Burns. Can you hear me?
Yes, we can hear you, John. Thank you.
For the members that don't know, Westminster Canterbury Richmond has a child care center on site, and we have been open now for a couple of months for our staff, and we've had a daily census of our kids in the 25 to 30. About 2 weeks ago, we reopened to the broader community. Today, we're running kids, about 75 kids a day. Now, these are all, mostly all younger kids. So for the school year, we are in the process of establishing a program. We'll take somewhere between 30 and 40 elementary and middle school age kids, put them in essentially conference rooms, socially distanced with some supervision, for essentially what is a camp rate, which is a reduced daily rate, because we can do that. We have a lot of conference room space that's not being used within our community. So we're taking some what would otherwise be resident conference room space and designating it classroom space. And we're not all the way there yet. We polled the community to find out what sort of interest there would be, and we've got about 50 families that are interested, who know us because their kids came here or continue to or still come here. So we haven't figured out all the policy and procedure implications. We did have VDH come, the epidemiology team, sat with us, looked at the spaces, talked about the requirements for cohorting and sanitation, or disinfection and sanitation. So we're pretty far along. I wouldn't say we're not ready yet, but we're very close. And we'd love to, if there's others out there who are headed in the same direction, we'd love to collaborate, because we feel a little bit like we're making it up on the fly with the help of VDH, which is, you know, they're maybe 1 or 2 steps ahead of us. So if you have ideas, please look me up, or you can reach me through LeadingAge. Thanks.
Thanks, John. That's really, really interesting and innovative. Any questions for John? Is anybody thinking about doing something similar?
Hey, John, can you all hear me?
Yes, who is this?
It's David Abraham from Beth Shalom.
Hey, David.
How are you, Dana?
I'm good. Thanks for joining us.
You're welcome. John, thank you for sharing. My question is, when you say there will be some form of supervision, how are you, what are you doing with respect to policies with regards to, I know there will be supervision, but is that supervision going to be used to kind of lead the children in their studies? Is the supervision just to make sure that everybody is socially distanced and everybody's going to be essentially on their own to take their own direction from their teacher online?
So it's a great question, and it's probably a little bit deeper into the weeds than I'm fully familiar with, but the parts of it that I can address. So our staff, because we are a child development center, most of our staff are either teachers, certified teachers, or certified teachers assistants. So they have some capability to teach curriculum, I guess is probably the right way to say it. Their primary role, though, is going to be to kind of be a room supervisor, make sure everybody wears their masks and stays socially distanced, and is able to either use their own hotspot or use our Wi-Fi system and stay connected to their instruction, whatever that looks like. And then we'll also provide some activity and exercise times so that they're not just sitting in front of a computer all day long. We'll get them out and get them and do some of that. So it's a little bit of both, but I think primarily it's going to be supervision for elementary school kids who have, are going to have some virtual instructor or instruction. I think we're going to learn a lot. I think we don't really know what it is we're going to need to do. The guidelines for this are very different than for the Child Development Center, where there's ratios which are really restrictive and make it hard for younger, like the 6 weeks to 6-year-olds. The ratios for staff to child are really high, and it makes this economically not make any sense. For a classroom supervision thing, it's 1 to 20, which makes it much more economical. We don't need to charge very much, and we can have one person supervise a couple rooms, and we think we can, the thing will make sense economically and be something that allows our staff to come to work. I think we'll probably have more to David's questions. The specifics will be worked out in the next week or two, but for sure by 2, but at least I think we'll have most of it in the next week. And again, I'm probably not, well, I know I'm not informed as well as the team that's developing all that, but I'm happy to share their contacts or get something set up. If anybody's headed in the same direction, let me know and I'll get you connected.
Thank you, John. Appreciate it.
John, you mentioned that it wouldn't cost very much. Can you comment on the payment structure? Will this be an employee benefit? Exactly how will that work if it's open to folks that are working outside the community? Could you comment on that?
So we offer a discount for all of our employees for all of our childcare. And then we have a sliding scale based on family household income. And so this will apply to families who are employees. They'll get a discount over the public street rate. I don't know exactly what the dollar amount is, but it's going to be the same as our camp rate, which I don't want to quote you. I don't know exactly what that is, but we have an established camp rate, which is a teen summer program that we do for parents of our employees who have, elementary and middle-aged kids that they need to deal with during the summer. They come here for a camp during the summer, and so that's primarily who's we're targeting, and that's a fee that they're already accustomed to. And we've heard that that's, people are very interested in that. It's cheaper than childcare, and they're with their friends. So I can get the details, but I don't know it offhand.
Thank you. Thank you. I know that also there are some daycares. I know mine personally is opening up as a virtual site for Henrico for folks to come in. So I do know that some daycares are opening up to be satellite locations. So that may also be an option for folks. Any other questions for John or other innovative things that our members are doing? Dee, I'd like to go back over to you.
Yeah, thanks, Dana. Yeah, it's, as you can hear, this is still quite a situation that members are working their way through and trying to set up other alternatives. The other half of the conversation that I've heard on this is, in those areas where schools are reopening. There's of course not that many right now, but I thought there were some really good points raised in these conversations. And one member specifically, said she's concerned about, when all the kids go back to school and then, mix and mingle and then come back home to where, of course, our employees are living with their families. And then what is the risk of transmission from there, through into the retirement community, nursing home, and et cetera. So, one of the things she was talking about, and others on the call as well, for this particular discussion, was, how to start preparing policies and protocol around, if schools do reopen, is there a need to do additional testing, screenings, symptoms checks, and so forth, especially for employees who have kids back in public school where they're mixing and mingling, because, and we've already seen on the news, a number of examples where some districts have had to shut down after being open only a couple of days. And, so lots of thoughts around that and discussion around that. How to start preparing, even though it's a little bit down the road, for that possibility. So that was another just point I wanted to raise, and that I've heard being discussed as we're trying to think through all of this. The other thing I've heard, just generally speaking, is folks trying to do other kinds of things, amongst themselves, parents getting together and doing small homeschool groups with private tutors. And so folks talking about how to maybe help people get connected around that, just if they're looking for options, within smaller groups that would be more informal. So that's another idea that I've heard discussed as this topic has come up. But I think it's going to be one of those, like we're doing today, we'll just have to keep talking about it and sharing ideas and see, what is going to work in different areas, and as states and counties open or stay closed, depending on the COVID spread in their area. So with that, Dana, I will turn it back over to you.
Okay, thank you. Melissa, do we have any questions in the chat box?
We do. We have one. How have providers changed their staffing model? Have most, in regards to care staff and nurses, gone part-time and flex? Has anybody had that experience?
And if you're on the phone, you may need to star 6. Okay, well, it doesn't seem that we have any feedback on that question. Are there any questions or any models that anybody would like to discuss? This is a safe space. We don't have any regulators on the call today. So it's a great opportunity for everybody to talk with each other and learn from each other.
Good morning. This is Winoka. Can you hear me?
Yes, we can. Thanks for joining us.
Oh, absolutely. Good morning. I'm calling from Vincent Hall in McLean, Virginia. And with regard to return to work, we have considered, we've talked about it. We've considered a virtual learning center of sorts. We've got some space that we could facilitate that. One challenge that I have faced on the HR team is knowing just how big of a problem it is across the community. I've sent out a few feelers, and the response has really been from our exempt staff. So trying to get a sense of how big of a problem or a challenge it will be. And so it was interesting, it was suggested to me that I run my benefit report to see how many employees have dependents and look at those school-age dependents, and that may give me a better idea of how many families are impacted. And with regard to staffing, if you will, or providing support in this virtual learning center, a couple of things we've talked about is if I am an employee and I bring my child to this learning center, then on my day off, I volunteer my time to help watch the kids. And so part volunteer coverage for this virtual learning center, and then perhaps maybe hiring a temporary person to help watch in this area as well. We don't currently have a daycare or anything like that on the community, but we are trying to provide something for our staff as everybody is looking at virtual education, virtual learning for at least the first several months of the school year.
Winoka or John, just thinking through this, and thank you for what you all are working on. You know, I know we're trying to keep social distancing, and the last thing we want is our residents exposed potentially. But has there been any conversations involving retired teachers that are in your independent living, or having any of your independent living folks volunteer?
This is
I
John.
know
I'll just
go ahead, please.
Go ahead.
So for us, that has been one thing that I did list as a possibility, absolutely. But this is so new to us, to me, that I'm open to any suggestions on how we can make it work.
So Melissa, to your question, at Westminster Canterbury, because we had a child development center, we had a lot of staff who were impacted as we closed and then shrank the program. And those teachers and teachers' aides have been used as temperature tent screeners and lots of other supporting roles. We're putting them back to work through this. And so we haven't really needed the extra, the help of the residents. And we've really looked at this child group, whether it's small kids or school-age kids, as cohorts that we need to very much keep isolated from each other and from the residents. And that LeadingAge's guidance has been to create cohorts and don't intermingle those cohorts with each other or with anyone else. And so that's our approach has been, you know, we're going to put rooms with 6 or 8 kids in them, and those 6 or 8 kids are not going to mingle with anyone else other than themselves and their teacher. And then if we have illness, we're going to try to keep those, keep those kids in a cohort where they have to be tested and before they can come back. And so we're working through all those details, but we have not in any form thought about bringing residents into those cohorts at this point.
And
Yeah,
to
makes
that
a lot
point,
Go ahead,
I'm
Winoka, sorry.
and to that point, I've even thought about care.com. I see the commercials on TV. Could we potentially hire those people to come in, right? Because they may not be working either. So we've thought of all kinds of ways to help support the effort.
Back to you, Dana.
Oh, I'm going to go back to Dee. Dee, are there any resources that you could suggest from LeadingAge National that members might be able to use? And then I also want to put out on the call, are anyone on the phone developed some policies that you could share with us that we could share with the membership to assist with this issue?
Sure, Dana. Related to the, let's say, operational policies around some of these ideas like the virtual learning center, as I mentioned, also I've heard some members talking about doing that elsewhere. I will reach out to those folks and see if they have anything developed yet, similar to what John is saying. Folks are still very much in the middle of building what their policies and procedures might be. I do have from, going back to, let's say, April time frame, members who had shared some of their leave-related policies after the CARES Act first came out, the challenges, we're working through right now is adapting those kinds of policies to the fall. A lot of them were geared more towards other issues, but I can definitely share those and see if there's language within some of those policies that folks can apply to figuring out what to do now in terms of adapting leave policies, or how you'll manage the unpaid part of it if folks have already exhausted their extended FMLA benefit. So I can send those over and see if at least that's a good starting point.
Okay, great. Thank you. And Melissa, I see we have a question in the chat box.
Yeah, I think you're probably the primary person to answer that.
Yeah, we're a community without a child care license. Does anyone know if volunteers are used to supervise a virtual lab, if this would be excluded from regulation by the Department of Social Services? So that's a great question. We can follow up with DSS to see how this is being handled. I'm sure John would probably have some comments on this, especially regarding the number of children that are in place are likely to activate regulation.
Yeah, we didn't ask specifically DSS this question, at least I didn't, but when VDH was here reviewing it, the VDH team didn't have any heartburn about it, if they're just doing supervision and that sort of thing. But I don't know. I think, let me say it differently. I think DSS is going to allow a lot more under the current situation than they would have allowed, not 6 months ago. I think they understand the challenge as well as anybody, and they've been very easy to work with, getting the child center reopened. And then in terms of working through all this, DSS has really let us do it the way we want to do it. So I think it's definitely worth a shot.
And Dana, to add to that, I'm sorry, this is Winoka again. As
Yes.
I've done the research, as I see it, there are two paths that we can go if we do this. One that is more regulated and we would have to have more certifications in place, and one that is less regulated. So there is a path that we potentially could go through that doesn't require all of the certifications and regulations. I can share that information if anybody wants it, but there is a way to do it without already having a child care license and things of that nature.
Yeah, could you please send that information to me and I'll connect with you and get that information out to everybody. That would be very helpful. Thank you.
And Winoka, a follow-up question came in. If you're not a licensed childcare agency, the assumption is your liability insurance would need to be reviewed and updated. Have you looked into that?
So that is the next step, absolutely, in our action items to get to the decision making, absolutely. So we've not looked at that yet, but we will need to.
Great, thank you.
Yeah, so actually, the Department of Social Services has joined our call, and the comment here is the best way to get answers for a specific facility and idea would be to contact your licensing inspector and let them know what you are considering, and they can put you in touch with the children's inspector to talk through your options about whether or not it would be exempt from licensure. Thank you, Cindy. And Mike Philhauer, insurance carriers are offering an endorsement to handle this exposure. Thank you, Mike. So it looks like we'll probably be wrapping up this call early today, and you'll get an extra 30 minutes back in your day. Everything that we've discussed, the recording will be in the update today. We will include any sample policies and follow-up answers to the questions that have been asked today. So please make sure that you check your update. Dee, did you have anything else that you wanted to add before we end? And if there are any questions left, if you could please put those in the chat box.
Yeah, sure. Thanks, Dana. Just a couple quick things. One, this might be a good opportunity to mention our member community again. When we're working through these kinds of questions and sharing ideas, that can be a good way to connect with folks across the country. And people post things there. I haven't necessarily seen this there yet. And I might just go ahead and post it myself, but this is where folks can share things that you can put up sample policies and a whole host of things that we've been talking about here today. So that's another resource that's out there as we're working our way through some of these operational challenges. Also, just want to remind everybody again, we're continuing to lobby our congressional offices about this next stimulus package. There's still time to reach out and participate in and getting the voices heard about the needs for aging services providers. We're still doing everything we can to bring forward all the shared challenges that we've talked about on many of these calls. So if you haven't yet, you can take a couple minutes, click on the links and to go and contact your congressional office. And that would be so helpful. All of us together is what I think will make the difference.
Hey, oh, you have a question, Melissa?
Yep. So I'm not sure who this question is for. Ryan, I imagine the Department of Health. How can I take residents on an outing in phase 2, but family can't come visit? Can family magically show up at the outing? I have a resident who wants to be baptized in the river. We all know family wants to be there. Thoughts?
We do not have the Department of Health on the call today, but would anyone like to chime in and respond to that? Okay, we will get you an answer and also share that with everybody. We are including a Q&A section starting today in our update, so we will include this one moving forward.
Yeah, and I would just say, Ryan, that there are lots of challenges that we're hearing from members around moving from phase 1 to phase 2. And we'll get you clarification, but in terms of family members magically showing up at an outing, you can't always control what family members do.
Yeah.
Thanks for that. Yeah, you said it was a safe space, so I thought I'd stick my neck out, but yeah, I just...
Yeah, and I'm doing the same with a wink, wink, nudge, nudge.
Well, and that's what I told my campus pastor. I'm like, if family members show up at the river, I can't tell them what to do. Anyway, yeah, we're just trying to work through and trying to figure out how we can do it safely and compliantly, but yet we know this means a lot to this family. So I didn't know if anybody else here had such a wacky question thrown at them or not.
Well, thank you for that. And Dana, I mean, correct me if I'm wrong, it's guidance going from phase to phase, correct?
It is, and it absolutely is. And being that this is an outdoor situation, I'm sure that there's a lot of flexibility too. But Ryan, we'll get back with you and get you some information on this.
Thanks so much.
One last call for questions. Okay, everyone. Well, thank you so much. Thank you, Dee, for being on with us. Follow up on things that we discussed today again will be in the update. And the August 12th call, if that's canceled, we'll let you know. We'll remove it from your calendar. And everyone have a great rest of your week.